oh my God, you have to do it. It's the literal best job ever. So here's how my career has gone. So I was a student midwife. During my training, I was placed on a bereavement ward where we dealt with people having stillbirth or like very kind of late miscarriages as well, and also a few abortions. And I found it so rewarding. I absolutely loved it. Like, I could have spent my whole time there. I had a really difficult mentor who did not support that. She didn't like working there, basically, and she used to say all the time that it gave her nightmares and that she was really miserable, but I could not get enough of it. And I loved just being with the women that I looked after, with the families, and yeah, it was brilliant. I loved it, despite having a horrible mentor. And I then, when I qualified, I wanted to get into kind of bereavement type midwifery, but sadly where I worked, there was some really well-established bereavement midwives who kind of, like, anytime anyone would come in, they would be given the case. So I didn't get any exposure to it as a midwife. And then I kept seeing this job come up at my local clinic and kept thinking, oh, that would be really good. But they were always looking for nurses. And then one day it changed to be nurse or midwife, and I was like, oh fuck it, I'll just apply. And I didn't, and I regretted it for ages. And then the job came up again, so I did apply and I got it. And yeah, so I worked in clinic for a few years. I was just a midwife in the clinic. Then I was the lead midwife in the clinic. Then I moved over to the aftercare team as a like a demotion almost. So I went back to like being a midwife in the aftercare team, which I just love. Like, I've loved all my jobs in abortion care, and then I became the lead of the aftercare service, or one of the leads, and then now I'm the manager of the aftercare service. But I am a clinical manager, so I'm able to give advice to my team, and I speak to patients occasionally as well, not as much as I should or as much as I want to, but yeah, that is my career, my life story. The very simple answer is, when you qualify, just have a look on NHS jobs for jobs in abortion care and see what appears and go for it. Do it. It's the best.